In this section, we're going to be discussing caregiver fatigue and self-care. We'll cover a variety of topics within this. We will discuss kind of an overview of who make up care partners, the sheer number of care partners. We'll also discuss, needs of a care partner, challenges. We'll spend most of the time, though, talking about different resources that can be helpful throughout the course of the disease. This will include interacting with healthcare professionals, how to make doctor's visits and hospitalization successful, also talking about making a move to a different living environment and things to assist you if the time comes for this. We'll also discuss advanced planning and end-of-life resources. So looking at an overview of family caregivers and statistics, this information comes from the Alzheimer's Association. You can see a link at the bottom. It's alzimpact.org. There's many more statistics, but I just pulled some that were really significant and stood out to me. So in 2018, there were 16.3 million family members and friends who provided 18.5 billion hours of unpaid care to people with Alzheimer's and other forms of dementias. So this is a huge number of family members and friends who are providing care. So just that, shows the significance of how many care partners there are out there. And then another interesting statistic is 1/4 of all Alzheimer's and dementia caregivers are what are referred to as the sandwich generation. So they're caring for both someone with Alzheimer's and then also caring for a child or grandchild. So, I like to point this out because this is something that's, even there's so many responsibilities for someone caring for someone with Alzheimer's, but then this is just adding a whole nother level of responsibilities. So understandably, this can be very stressful for people who are having, caring for two different individuals at different spectrums and stages of life. Nearly 60% of Alzheimer's caregivers rate that emotional stress of caregiving is high or very high. And then 40% of family caregivers of people with Alzheimer's suffer from depression. So this is very important to point out so that you as a caregiver can make sure you're aware of your emotional health needs so that you can get the supports that you need if you are recognizing signs of depression. And then finally, the physical and emotional impact of caregiving on Alzheimer's and other dementia resulted in an estimated 11.8 billion increased caregiver health costs in 2018. So what this statistic is pointing out is that, physical health of the caregiver can suffer as well. So, there were significant increased cost for the caregivers. So just making sure that you're going to your routine physicals, looking after your own physical health as well as emotional health throughout this journey. Because you're not going to be an effective caregiver for your loved one if your own physical health and emotional health are suffering. So making sure you're taking care of yourself as well is really important. Something to point out is that needs will be different throughout the disease process. Something that we, say a lot is that if you've met someone with Alzheimer's, you've just met one person with Alzheimer's because it's not something that's, standard across the board. Really, everyone varies in how quickly they progress, what symptoms are, and what's effective for them. So just remembering that your loved one is unique is really important. Typically, needs will vary throughout the stage of the disease. It's not something that's always clear cut, but kind of generally we talk about an early, middle, and late stage of Alzheimer's disease. Typically early on in the disease, it's really important to get a lot of information about the disease, do some research, educate yourself about what this disease process is going to look like, what you can expect. This is not always easy to do. A lot of times, we're in denial, we're upset, rightfully so, about this diagnosis and don't really want to look to the future. And unfortunately, the difficult things to come, but it can be really helpful as, the disease progresses to have done that education up front so that you know what resources and supports are available. Um, reaching out to other people who have gone through this experience, a support group, that can be really helpful in the early stage too. Um, Middle stage might be thinking about needing some more support as the person's physical health declines. Home health assistance can be a lot of times helpful in the middle stage, seeking out family and friends for support. And then in the late stage, typically the person's needing a lot of physical care. A lot of times, this could be, middle or late stage could be potentially making a move to another living environment with more support, such as assisted living, long-term care. This could be getting more assistance in the home. Could also be looking at kind of, would we like to get hospice or more comfort care approach in the late stage? And again, this is going to really vary for the person, what's effective and what they need. Having early conversations, doing that research up front is really important so you and your loved one's preferences can be honored. You'll really become an advocate for your loved one, just to make sure that they're getting the care they need. So that's, really important to do the research and think about these things early on. Um, communing with Communicating, with healthcare professionals. This is something that we have a handout to refer to as well. So something really important that I always, talk through with families is making a list of questions. So, a lot of times there's things that come up through our daily life that you might have a question about for the physician, but then when the time comes for that appointment, it's left your mind with everything else going on. So having a designated notebook where you keep questions as they occur is something that can be really helpful. And then you can bring that with you to the appointment to kind of go over those questions with the physician. Something else that's helpful is tracking different symptoms, different things, changes that come up with your loved one so that they can be discussed with the physician as well. So this could be something in the same notebook just to kind of track if you're noticing a change or a struggle, kind of what it looks like, how frequently it's occurring. This can be information that's really helpful for your physician to know. This could be something like, they're starting to have trouble independently toileting or bathing. How long has this been going on? And the physician and you can talk through things that might be helpful for that. That could be, getting occupational therapy in place, which requires a doctor's order, and they could help your loved one be more independent with those tasks for as long as possible. And when you're thinking about these changes, really thinking through your daily routine, because sometimes the changes happen and you're with the person all the time and you might not realize, oh, that's a change worth talking to my physician about. So just kind of thinking about your daily routine can be helpful. This, is things like dressing, bathing, toileting, meals, things you do throughout the day, thinking about what's becoming a challenge, what's changed, what's something they used to be really independent and successful with, but aren't anymore. And this can also be activities of enjoyment. Maybe they really used to enjoy reading and for some reason they've stopped or getting really frustrated. So, this could be discussing different options. Maybe would they like to have audiobooks now? Would they like to, is it a vision issue where they need larger print? Would different types of books be more enjoyable for them at this point? So just little things like that throughout the day can be worth noting. Something very important is keeping a list of their medications, bringing that with you to all medical visits, whether that's, hospital, if you have to go to the ER for some reason, or a doctor's visit. That can just help reconcile, make sure things aren't negatively interacting with one another. Also can help, guide their treatment. So medication list is very important to have with you to communicate with healthcare professionals. Also, during those visits, taking time to discuss your loved one's preferences, your preferences regarding aggressive treatment, and when the time comes, kind of end of life care. Um, you know, you can always ask, if there's an aggressive treatment recommended, such as a surgery, something like that, just asking what would the alternative be? What would happen if we didn't pursue this? Are there, options for more comfort versus aggressive treatment? This includes, talking about risks versus benefits when these things come up, especially during late stages. What's the benefit of this surgery going to be? What are the risks? Really thinking through those things. Um, these communication strategies are really helpful during hospitalizations as well. Hospitalizations can be very overwhelming and frightening for someone with Alzheimer's. So you as a caregiver are really an advocate for them, communicating their wishes, what their typical cognition looks like so that the hospital staff can respond appropriately and provide them the support that they need. A lot of times it's important for the care partner to discuss, what type of care the person's going to need following the hospitalization. Is this something you think that you can realistically provide at home, or, are you needing to get some support in place following the hospitalization, whether that's home health? Staff might discuss the person needing a stay for physical or occupational or speech therapy. So this could be in a post-acute rehab setting. This could be in an inpatient setting, but just kind of discussing if that person needs follow-up therapy before they're able to come home successfully. Or is this a time where we're considering, a change in living environment? Are they needing a more, 24/7 professional care in a long-term care assisted living type facility? And again, you can refer to the handout provided about communication tips. Now we come to when to consider making a move to assisted living or long-term care. And this is something going back to everyone being so unique. There isn't, a checklist you can use to know when it's time. And this is something that's really emotional and a difficult decision for many caregivers and family members. Kind of some general things are looking at the person's physical care needs. Kind of a big indicator that it might be time to make a move is that if you as the care partner can't physically transfer the person, if they're not able to independently walk, if they're not independently able to get from a bed to a wheelchair or from a seated position to a wheelchair by themselves, and you're not physically able to lift them, that could be, kind of an indicator maybe it is time to look at some more care. This would be to prevent, the person from falling and having an injury, and then you as the care partner from injuring yourself during those transfers. So that can be kind of a physical indicator. If someone's having, more and more hospitalizations, a lot of times that's when it could be a good time to consider, would professional care in a long-term care facility, would having nursing staff with eyes on all the time help eliminate some of those hospitalizations. And then something else to talk about is resentment, which can be a really negative word, something we, don't want to think about in terms of our relationships with our loved ones. But being, a sole caregiver, having to provide all of those hands-on care tasks can cause some resentment because, that's something that's extremely burdensome, something that's, really physically demanding, and can kind of make us lose sight of our personal relationships with our loved one because that caregiving task relationship is so present. So a lot of times people will consider making a move so that, the professional caregivers can provide those caregiving tasks and you can really focus on your relationship with the person. So you can focus on being, a spouse, partner, son or daughter to the individual and have quality relational time rather than having your time comprised of all of the caregiving tasks. So that's something important to look at as well. When you're looking for a facility, obviously everyone wants a safe, quality facility for their loved one. A good resource to look at this is Medicare actually has a website, medicare.gov/nursing home compare. For this, you can enter in your zip code or your city or town, and they will generate a list of facilities and what their quality measure ratings are. So that can be a really good starting point. Also, certainly, taking tours of a lot of different facilities, talking to staff, getting more information can be really helpful. You can even, we recommend, taking your loved one to tour as well, getting a feel for the environment, looking at cleanliness, looking at current residents. Are they clean? Are they well groomed? Are they, appear happy and satisfied? So that can be something that's helpful too. Preparing a loved one for the move can really depend on the individual and their stage of the disease. If someone is at a point where sitting them down and talking with them about this, they're not going to retain that information, that might not be the best use of time. But if someone is still able to, retain some of this information, certainly sitting down, discussing, how they feel about this, what they would look for in a place where they would like to live, taking them along to tour, interact with the staff can be really helpful. Something else that's really helpful for families, kind of no matter the stage, is making sure that you're making their new room a comfortable environment with items they're familiar with. So something that's helpful, kind of later on in disease process, a lot of times families will move items and set up a room prior to someone moving themselves, so that when they get there, they're surrounded by things that are familiar, comforting to them, that can make the transition a little bit easier when they're in this new environment if they have some things that look familiar to them. This can include, favorite items, familiar furniture, pictures of loved ones, family members. These are also really good talking points for staff as they get to know the person. They can, discuss how happy this family looks in this picture and tell me a little more about that. That could be a great conversation starter. Along with that, interacting with staff, your loved one better than anyone else. It's really important for you to communicate their preferences, their interests, things that they don't like with staff, so that they can make that transition as smooth as possible and successful for the person. Most facilities will do a social history upon someone moving in, and this is a time for you to really describe, activities they enjoyed, what their former profession was. Are there certain things that really bother them? Do they hate the loud TV noise? That's really upsetting to them. When they do get upset, something that works is, giving them a warm cup of coffee and a blanket, and that will typically comfort them. All of these things can be helpful for staff to make sure that the person's getting the care that they need, and help with that transition. So even if it's something small and seems silly, I encourage you to communicate that with staff so that they can help make the routine as similar to home as possible. Certainly asking questions of staff is really important too when you have them. This is all new to you. Staff do it a lot with new people moving in, so sometimes they might not think of something that's a really good question for you. And in bold at the bottom, your role as a care partner does not end. You will continue to be an advocate for your loved one. You'll continue to make sure they're getting their individualized care that they need. Advanced planning and end of life conversations. This is something that's, difficult to have. Could be really overwhelming and something we don't always want to think about, but it is really important. It's important, if possible, to have these conversations early while the person can still participate and state what their preferences are. And this can help alleviate stress as the disease progresses, if these conversations have been had early. Different advanced directives that we talk about are durable power of attorney, living will, do not resuscitate, and a guardian conservator. Durable power of attorney is something that people can have for healthcare or finance or a combination of the two. This is something that can be created with an attorney. I really recommend this if you're really wanting it to be specific to you and your loved one. This can be something that's drawn up with an attorney. Also, if you have a lot of questions about it, working with an attorney who can answer those questions is helpful. Healthcare facilities typically have general forms as well that you can that can be filled out and then notarized and become effective at that point. The individual does need to be able to understand the document and sign for him or herself in order to create a durable power of attorney. Typically, they're going to want to look at someone who's, accessible, and then someone who they feel like really understands their wishes and will carry out their wishes and preferences. That would constitute someone who'd be good for the role of a power of attorney. Typically, the document will not only have, your first power of attorney, it'll have the option of having one or more alternates as well if the first agent is unable to be reached for some reason or not able to make a decision on behalf of the person. People also typically want to look at preferences regarding more aggressive treatments, in the event that they would need to be placed on a ventilator to sustain life. A living will can kind of outline their preferences of, no, if the time comes, I would not like that measure taken. I would like to pass naturally. That can be outlined in a living will. And again, the person has to be able to understand that document and sign for themselves in order to create that. A do not resuscitate would be a document put into place if someone does not want to be a full code. So typically, if there's not a do not resuscitate in place or that document's not accessible to medical professionals, they're going to defer to a full code, which means if someone's heart stops, they're going to do all that they can to revive the person and sustain life. So that includes, performing CPR. If someone does not want that measure taken, if, their heart stops, they want to pass naturally, they would have a do not resuscitate or DNR in place. This is something that has to be signed by the physician. And is something definitely, if you have questions or would like this in place, talking to your physician is a good option. Other healthcare staff can kind of give you more information, but it is something that does need to be signed by the physician. A guardian and conservator, a lot of times this is something that comes into place if someone never had a durable power of attorney and now they're not able to make decisions for themselves because their cognition has deteriorated, and family, needs to be able to make decisions on behalf of the person. They can go through the court system and get a guardianship in place. Guardianship typically is making those healthcare decisions and other types of decisions guiding someone's care, where a conservator deals more with the financial side of things. Sometimes this can also be put in place if unfortunately there's a conflict and the person and the caregiver or loved one don't have the same outlook on the way they want things to go, and the person is not able to make decisions for themselves. Again, this can be taken to the court, and a guardianship can be put in place if necessary. Funeral arrangements are also something important to discuss early on. Again, something that we don't, typically enjoy talking about, something that can be really emotional and scary to discuss. But again, having these conversations early when the person's able to participate can help alleviate that stress when the time comes and there's, lots of other emotions at that time. So talking about preferences, would they like a service? What would they like that to look like? Which funeral home? Visiting with funeral homes can be important and helpful. And then getting the financial side of things for that funeral in place as well. Additional end-of-life resources, more discussing the person's end-of-life care. Palliative comfort care is something that we're seeing utilized more and more today. This is something that's really, versus focusing on aggressive treatment and treatment that's going to cure a condition. It's focusing on quality of life and comfort without having some of the guidelines, more specific guidelines that hospice entails. So a lot of times a healthcare facility, a hospital, or a long-term care facility will have a special palliative care team. This can consist of physicians, nurses, social workers, to really help families know what resources are available and help guide the person's care in a way that's successful for that person. Sometimes this can mean someone's not going to take as many medications. They're going to be focusing more on just that medication and care that provides comfort to the person. Um, People will choose to do palliative care but continue to receive life-sustaining treatments, things like chemotherapy, dialysis, but then they're just getting that additional support and preparation for taking a more comfort care approach. Hospice care, again, this is focusing on quality of life and comfort versus treatment that's going to cure something or more aggressive treatment. But with hospice, it is something where someone has to qualify with their diagnoses. They also need a diagnosis with a 6 or less month life expectancy. This, doesn't mean that the person's in their final days or weeks of life. People will utilize hospice for the full 6 months. Sometimes people even graduate from hospice and are living beyond the 6 months. So they need that diagnosis, but it's not something that has to be exact, and there's no way for it to be exact. Hospice, again, has a team. Physicians, nurses, they usually have a chaplain available, volunteers, social workers who can provide support both to the individual and the family. Something, people don't always think about are the resources for family members. But these professionals, are trained in end of life care, and can provide a lot of information and that emotional support that's so important. And with hospice, they'll follow up with the family member up to a year after the person passes, if the family wishes to receive that support. So that's something that can be really helpful to have that support system in place. If you're interested in these options, definitely talking to the physician. If someone is living in a long-term care assisted living facility, talking to staff there about what options are. There's different companies that provide these services. And it is the family's choice and the individual's choice which hospice organization or palliative care organization they would like to receive care from. Hospice is something that can be provided in a variety of settings. The person can remain in their home and receive hospice care. They can be living in a long-term care or assisted living and receive hospice care in addition to the care they're receiving from the facility. And then some hospice organizations have a hospice house where the person can receive their care. So finally, just kind of doing an overview of resources, wanted to share resources that we provide at Meadowlark and then other resources as well. As we point out at the top of the slide, a lot of times it's difficult to accept help, especially in early stages of the disease, because we don't want to think about the scary and difficult road ahead, or, we want to take on a lot ourselves. Maybe we've talk to the person and promise that, we would keep them in the home and do it all. But this is, a really difficult disease with a lot of different emotional and physical components. So, accepting help is definitely not a sign of weakness and can really help with, both your physical and emotional health as a care partner and help the person receive the quality care that they need. So with Meadowlark, we have a memory program that offers a lot of different resources. We have a care partner support group that's free and open to the public, very informal, just a way to talk to other people going through similar situations, discuss challenges, see if other group members have faced something similar and have tips or resources that could be helpful, and just a time to get that emotional support in a safe environment. Meditation and exercise programs that we offer are both for care partners and people with Alzheimer's. This is, an opportunity to help with that emotional health by, taking time for yourself to do something positive for your body. Exercise has been researched to have many benefits for Alzheimer's disease as well. And then we offer a lot of education opportunities on a variety of topics related to Alzheimer's to help care partners prepare and maybe get supports in place that are needed for the person with Alzheimer's, and just to kind of learn more about the road ahead and what's available to you. Other resources, something I referenced in the slides, especially about tips for communicating with healthcare professionals and making hospitalization successful, would be Next Step in Care. Their organization has a website, nextstepincare.org. They have a lot of great resources for caregivers. They have printable guides for making the most out of doctor's visits, hospitalizations, kind of what to expect from a hospitalization. So lots of great resources there. Kansas Legal Services is a organization that provides free or reduced cost legal services. So if you are interested in having an attorney help with some of those advanced directives or have questions, but cost is a barrier, working with Kansas Legal Services might be something that's helpful for you. A lot of times people utilize private attorneys for these situations and creating documents as well. So if you have a relationship with an attorney or are able to hire an attorney, they would be a great resource for some of that advanced planning. The Riley County Senior Center is a great resource too. They have a lot of similar programming as far as care partner support group, different education opportunities for caregivers and people with Alzheimer's. The North Central Flint Hills Area Agency on Aging. This is also a great source for resources and information. They provide a newsletter for caregivers. They have a monthly call for caregivers just to discuss resources and supports. They're just a great starting point if you have a question or need a resource. They will, give you information to answer your question, or they'll direct you to an agency that could better answer your question. So they're a great starting point if you need something. The Alzheimer's Association is also a great resource. They have a really good website with lots of handouts and information and education for care partners. Their website is alz.org. Again, like I said, just lots of information sheets and resources. Family Caregiver Alliance also has a great website with information that's helpful for caregivers. They do free webinars on a variety of topics related to being a caregiver for someone with Alzheimer's or dementia, and just can give you a lot of good tips and strategies there. So thank you for listening to this information about caregiver fatigue and self-care. If you do have any questions, please hang on to those and we can discuss them during the in-person section of the course. As always, I thank you for what you're doing. Caregiving is a difficult job, but something that's very, needed with this disease, to have that loving, quality care. So I just thank you for all that you're doing for your loved ones.